Hello and welcome to GBN Health. I'm Lucy Johnston, Health and Science Editor at GB News. Now, Trump has ordered an exit from the World Health Organization in a controversial move. The United States will leave the World Health Organization, President Donald Trump said on Monday. He stated the Global Health Agency had mishandled the COVID-19 pandemic. I'm joined today by Professor Karol Sikora. He's a senior expert in cancer, and he also used to work for the World Health Organization. Welcome, Karol. Karol, why do you think that the UK government should follow the US in exiting the World Health Organization?
The WHO is a great organization in the past, set up after the ravages of the Second World War to help world global health. It's sort of lost its way about 25 years ago. I joined 20 years ago for a couple of years, ran their cancer program, and you could see it's an organization of bureaucrats. The director, for example, isn't even a medically qualified doctor, and it's just not providing value for the world. We pay $6 billion to run it. The US pays $1 billion in contributions. For the last 25 years, governments have been saying, for goodness sake, let's get reform to this organization. Let's get proper experts to work for it. Instead, you just have relatively highly paid paper shufflers, and that's what's gone wrong.
Surely the World Health Organization is the overseeing body for watching for new pandemics, for helping people join existing health programs. Surely we need to contribute to the global health because health is a global issue. I mean, you're saying it needs reform, but what particularly, where is it going wrong?
I think what this is, it's a sort of poker game of brinkmanship. By threatening to withdraw for one of the biggest funders, the US, the other biggest funder is China. If the big funders withdraw, it will have to reform. It just can't carry on. It's like a huge public sector monolith enshrouded by the United Nations. Everyone has a diplomatic passport and so on. There's a lot of nepotism. It's no surprise that when you go to relatively poor countries, the WHO representative happens to be the brother-in-law of the Minister of Health, for example, because they get to choose who they have, and is paid a Geneva-type salary to live in a country where the average earnings is $10 a day, for example. So there's a lot that has to be done for it. And, successive directors have tried their best. I mean, the one I worked for was super. She'd been the Prime Minister of Norway, and she was just great. But after 2 years, she gave up. Just couldn't take the lack of ability to restructure the organization.
How does this manifest? I mean, you talk in general terms about the fact that it's a huge organization that is not sort of functioning. But what happens? Why is it? What's going wrong?
Well, if we take COVID, that's a great example. The instructions coming from it. Governments are looking for help. They wanted to know what to do. The guys at immigration at Heathrow wanted to know what to do. And who better than the Global Health Organization, the WHO, to give that direction? First of all, they didn't issue anything. Then when they were asked to show, keep borders open, don't bother with it all. And then suddenly they panicked and said, we've got to close borders. We've got to have certification. We've got to have vaccine passports and all that sort of thing. It was not based on any science. And then in the aftermath of COVID, when they did the inquiries to the origin of the virus for COVID-19, which clearly came from the Wuhan Institute of Virology in China, they sent a delegation. They covered up the fact that it could have been a leak from the laboratory. I mean, we're looking for the truth. We're not looking for some judgmental qualities here. We're not blaming anybody. We just need to know the truth to prevent it happening again. And they skewed the results in favor of China. And that's how it's been perceived. And I think that was a big mistake not to come out on top. They should have sorted out COVID. For goodness sake, they sorted out smallpox 50 years ago. The last case of smallpox in Africa was a long time ago, and that was due to WHO help. And there's a big plaque in Geneva triumphing that, as they should be. But the way that COVID was handled shows the lack of in-house expertise in a life-threatening situation.
I mean, they would argue that we didn't know it was a new virus. We didn't know what to do, and they adapted according to the evidence that they had at the time. They would argue that it wasn't mishandled. What's wrong with locking down and keeping people safe in their homes until we have a vaccine? What was wrong with that?
The vaccine came very quickly, Lucy, as you know. And I think what was frightening at the WHO level, they were trying to try and handle it as a political game almost, instead of actually coming down on evidence and looking where the evidence shifted. It was just to keep the big donors happy, to give them what they wanted. And I think the biggest mistake was to suddenly change the way in which international travel went. If you remember, it's difficult to imagine, it was only 4 years ago, but you couldn't arrive in an airport and go out. You had to go, if you came from some countries, quite a lot of countries, you had to go into quarantine for 2 weeks. I nearly got caught going somewhere when I was phoned up by my host and told me, for goodness sake, don't get on the plane. They'll put you in a military camp for 2 weeks if you come. So, and this was all the rules were changing by the day. I remember at Heathrow, they had bits of paper for different countries that they photocopied to look at the rules, and everyone was doing something different. And that was just total lack of leadership for the Global Health Organization. So we've got to have something better. And it needs better leadership. It needs better expertise. And remember the other thing, infection, other than pandemics, are no longer the big problem. Even in the developing countries, it's heart disease, cancer, diabetes, obesity. And it really has no expertise in those areas. It's tried to move into it. I had 2 people working for me for the whole world, and that was it. And we tried to raise money. We raised some money for a sustainable scheme, but it was so bureaucratic trying to get it into operation. And so I think it's not been able to make the transition for when people filled hospitals because they had infection to now when people fill hospitals because they have non-communicable disease and are old with multiple comorbidity. That's the challenge for healthcare in the world. Less dramatic than those films about pandemics, but much more important to most of us.
You say that the World Health Organization makes decisions with political motives and with the motive of keeping its paymasters happy. I think that's what you implied. Who are those people, and why do you think it's influenced by them? I mean, is there good evidence of that?
I think most of us that have worked for it think that China and the United States are the 2 biggest donors, if you call them that, and they have the biggest influence. Britain has a curious relation in that it puts nearly $250 million in each year, and Germany only puts $30 million in. So you can see that Britain is a bigger influencer, and there's no doubt the more money you put in, the more seats you have in what's called the World Health Assembly. This is a mighty festival held in the Palais de Congrès in Geneva, and usually in April or May every year. And they're lined up with black Mercedes with countries' flags, and their ministers all arrive. I had the pleasure of giving a talk on cancer in the year 2000 to the World Health Assembly. I must say, you get better response for a bunch of first-year medical students.
Do you fear that if we have another pandemic, the playbook will be the same, and that there's been no lessons learned about lockdown until there's a vaccine and shut down all sort of economy, really, which I think you've been quite vocal in your views on whether that did more harm than good?
I think the WHO doesn't have the respect to implement anything. No one's going to sign a pandemic treaty now. The United States are not, China's not, they're not going to take any notice. Each country is going to come up with its own plan, which almost certainly will be less stringent than what we saw. It was almost like someone had pressed the panic button, from Boris, the Prime Minister in number 10, pressed the panic button, I think 24th of March in the year 2020. And it's that moment. Why then? What was the day before? before, the day after, what difference would it have made? So I think what we need is a proper pandemic preparedness plan, and that's there. And most countries have now got it. They don't really want and probably won't listen to an overarching plan coming from Geneva.
Do you think that there are other influences on the World Health Organization other than member states and their funding?
The drug industry tries to influence it quite profoundly, but it's resisted that, and so it should. It shouldn't receive drug company funding because you can dress up marketing of expensive drugs as, advice in terms of things like cancer management and so on. The whole issue of some of the big vaccine makers and how they've got away with it, and the transition and how they've got involved in governments, including our own, is a little bit bizarre. People have made a lot of money out of these pandemics, and the RNA vaccine makers have made a huge amount. And the shares, as you know, went right up. And if you're buying a vaccine for everybody in your population on several occasions, as has happened in Europe and the United States, it may have been the correct decision, but many of us think it was over-egged a bit, especially around children. And the risks are now coming out, the side effects, which may be rare, the serious side effects, but, if you're going to vaccinate a whole population, even a 0.01% is a lot of people.
Yes, and you have to look at the risks and then the benefits in each population, I suppose. Do you feel that there should be something, though, to oversee the health of the globe? Or do you think it's inappropriate to try and have one big body to look at the health of the globe, which has obviously got very different needs and very different expectations and access to things?
It could reinvent itself, it could transform itself, there's no doubt, into an organization of expertise rather than one that's political and diplomatic, and be independent of its funders in a way. It doesn't need $6 billion to run, and that's a ridiculous amount of money to have fronds in every country. When it began, the history was about protecting rich countries from the infections of poor countries. The yellow flag of yellow fever, when you came up the Suez Canal, if someone had yellow fever on the boat, it's no coincidence that the headquarters for Africa of the WHO is the Port Sanitary Building in Port Said at the top end of the Suez Canal as it enters into the Mediterranean. So that's the sort of thing that we're looking at. In the past, that organization could cope. Now, we're a world of instrument. The fact that we're talking like this down the line so easily and so clearly, the communication has totally transformed in the last 20 years, far less the last 100 years.
So how would you reform it? Well, you've said I think you tweeted out today that you wouldn't want to reform it. You've said that we should stop funding it altogether. Would you put something else in its place?
I would put something else much smaller, costing much less, and not a luxury organization that it's become. And without the bureaucratic structure and the need to translate everything into 6 languages for any single document, any single letter, it's got to reform itself, and it's got to be connected to the real world. It's got to be connected to expertise. So the cancer section should be connected to a cancer center somewhere. The malaria section has to be connected to a research institute. It could be in Africa, it could be in Europe, doing research on the malaria parasite. And that's the sort of thing we need to see, instead of just a paper shuffling organization.
So you said we're spending 250 million, is that a year from Britain? That's our donation, is that right?
Exactly. That's our contribution.
And you don't feel that we're getting any value for money at all by that?
We're certainly not getting that kind of money. I mean, you can imagine what a grant of 250 million to a university department in London or Cambridge or Oxford or in Newcastle would actually get you. It would buy you a lot of people and a lot of expertise. And of course, we're in a world you don't have to be anywhere. You can do it all online. So, and then it comes to the practical management. And the WHO was never good at practical management. It's got a great brand. Every time you go to a tropical country, they spray the plane with little canisters of insecticide, and they tell you WHO guidelines. You all feel reassured. It must be okay. We're not going to be poisoned by the pesticide. But and you want to have that. People want that. They feel comfortable with it. But who's really made the decision? What's the evidence base for those insecticides on planes? No one's taking responsibility for it. There's no one saying we invented that here in Geneva.
I understand. So the checks and balances are not what you think are robust. And do you think there's any hope? I mean, just two things really. One is that I have heard there is a treaty, a pandemic treaty, a new one. You don't believe the government's going to sign it and sign away all our rights to decide how we deal with the pandemic. You don't think that's going to happen?
I don't think it will happen. And that's the tragedy, that if you have a pandemic treaty and major nations don't sign it, then it's not worth the paper it's printed on. And there's always, in any treaty, there's winners or losers. The infection, say, starts in the East, then the countries in the West will want to shut their borders to people coming from the East and vice versa. So that's the problem with it. Is to say people hum and ha. Even if the evidence is there, can they obfuscate the evidence for their own political ends? And that's the trouble with the organization as it is. There isn't the expertise there to get over that.
You're very brave, I think, to speak out about it. Are there other people in your academic and professional circles that feel the same, that wouldn't speak out about this and do feel that we should end our funding of the World Health Organization?
I think, because I'm in the cancer world and therefore non-communicable disease, away from the infection and the pandemic, the most benefit to the world of the organization is from infection control. There's no doubt about that. The epidemiology, studying how viruses, how other organisms spread and what we can do about it. And that is where it really should go. It's failed completely in the non-communicable diseases, and they need money to treat. So a poor country is not going to be able to treat them as effectively as a rich country. It's as simple as that. Poor people even in rich countries do poorer in terms of survival from cancer, heart disease, heart attacks, and so on than rich people. And the WHO has no innate expertise on that sort of thing. It should reform itself and focus solely on infection and providing a source of information about organisms that cause disease and how they spread and how to stop that spread.
And you don't think that the government here is going to sever ties anytime soon? Do you think that they're not interested in having this discussion?
They're not interested in. I think the British government will reach a compromise. They might reduce the contribution. If Trump really carries out his threat, I suspect it may be negotiable if they go for a reform structure. But if he does carry out his threat, that's going to be the end of the WHO, and some other organization will have to come into being. But not as easy as it seems. I mean, it's like Trump's idea of getting rid of diversity officers by putting them out to garden leave tomorrow. I can imagine this army of diversity people stuck on having forced holiday before they get sacked. It just doesn't seem realistic in some way. So, but I think what will happen, a negotiation will come. America will reduce its contribution. Some sort of arbitration will result in the continuation with the hint of reform. Whether it can reform, we have to wait and see.
Well, it's been an absolute pleasure to talk to you today, Professor Sikora. And thank you for watching. This has been Lucy Johnston. And don't forget to subscribe to GB News YouTube channel. Thank you.